The World Health Organization most transmissible COVID-19 subvariant XBB.1.5 has been detected in South Africa. The variant was discovered in gene sequencing carried out by researchers at Stellenbosch University from December 27th sample. Head of the Gene Sequencing Institute of the University, Tulio de Oliveira, shared the news on social media. The Department of Health says it has been alerted about the variant and is currently in discussion with scientists to gather more information, including its transmissibility and severity. Let's get more on this. When I joined via Zoom by health activist Dr Kgosi Letlape. Doctor, pleasure to see you in the new year. A very good afternoon to you, and thanks for giving us your time.
Good afternoon to you, good afternoon to the viewers, and a happy new year.
Yeah. Doctor, let's talk about this. We're hearing that the department has now been alerted about this variant and, of course, is now in discussions with scientists about the severity of this particular variant. What is your reaction to the news then?
My reaction is hopefully they will come forward with the information of who was the patient, where was it found, where did the patient come from, did the patient travel, and that the precautionary measures of isolation and alerting, tracing of contacts will begin. What we do not want is to begin when the virus has spread beyond what is reasonable. So hopefully the basic measures will be taken to ensure that we can cap the spread of this more transmissible variant.
I mean, throughout, Dr. Letlape, we've always had conversations with you regarding COVID-19. And one thing you've always cautioned against is the issue of panic. But it's difficult not to panic and for the public not to panic when we're hearing, and what we're reading, especially on social media, that, South Africa has found the first case of its most transmissible COVID variant. How should we as the public react to this?
We should be encouraged by the fact that the authorities are still doing testing and genotyping and looking for subvariants. And once you have the information, then you can do something about it. But equally important would be the fact that the NICD and other authorities need to make sure that they can trace and isolate where that virus has come up from, so that we use the basic methods of ensuring that we do not spread the infection. But also the basics to community. If any of us has a flu-like illness, isolate yourself, don't go to work, don't spread it to others, and we continue with the good habits of cough etiquette, hand washing, and using a mask if you're in compromising situations.
Doctor, you've said that it's a great thing.
Anybody that's going to be flying, use a mask when you're in a confined space.
Doctor, you've said that, it's a great thing that, this has been detected and that authorities are indeed looking into it. What should our health department at this point, while considering what's happening, do in order to swiftly sort of deal with this particular variant? What are the to-dos at this point? And certainly what have the lessons that we've learned having been in this pandemic for what seems to be such a long time?
I think the do's are fairly simple. Clear, transparent communication about the source, whether there is a history of travel from that person, so that we can trace what the source was, whether the person has brought it from outside, and if so, has it been contained? Any of the contacts that were with that person should also be contacted for testing and follow-up. So we must just continue doing the basics, but I think the key issue is we being given the full information about where it was tracked from, where that person was traveling from, so that we could have the full confidence that all information is being made available. I mean, if you know that you're on a certain flight with a person and you were on that same flight, you then also be cautious in terms of isolating yourself from your family members, making sure that if you have symptoms, you get tested, or you get tested anyway if you're on the same flight, for example, if this is traced to a person or that has a history of recent flight.
We heard from the WHO that they are planning on an updated assessment on the various risks in the coming days. What would this process sort of entail, and what information do you believe would be receiving from the World Health Organization on the back of that?
I think the information that would be receiving is on the full gene sequencing of the subvariant, on the characteristics of the subvariant. Is it causing severe disease, or is it just merely more transmissible than previous variants without causing severe disease? So all those factors would have to be, that information needs to be given based on the epidemiology of the subvariant that has now been detected.
Yeah. Doctor, it's very interesting to note that, there's a lot of criticism towards China as to how they've been dealing with COVID. And we hear that they're dealing with another extreme wave at this time of COVID-19. Is it fair, all these criticisms that are directed towards China? I mean, bearing in mind that they've had, the hardest lockdowns, the most stringent measures in place in the past. Is it fair still to point that finger in the direction of China, as I see is being done at this time?
I think if we're going to deal with COVID-19 decisively, we must deal with it as a global community. There should be no finger pointing, so that when people have cases, they are encouraged and free to share that information. This blame game and criticizing each other is not helpful. I mean, not so long ago, China was criticized for a hard lockdown. Now it is being criticized for opening up. So what is it that they are supposed to do? What is the prescription to deal with COVID? As long as there's transparency, openness, and sharing of information, then all of us will be safe. As long as any country will always disclose what it has detected, it does test to see whether there are new variants that are coming up, is truthful about the number of cases, the spread of the disease, the number of fatalities, and how the health system is dealing with it. So that you can then ensure that when people travel from an area that has been hard hit by COVID, receiving countries can take precautions.
Yeah. And Doctor, I mean, the issue of new variants, is this, the new normal for all of us? Is this a reality that we have to face, that this is what things will be like, for the foreseeable future, that every now and then we'll hear of a new variant, or an even harsher variant or more transmissible variant? Must we make peace with the fact that this is, our reality?
We all need to understand that viruses survive through the variations. That's how they protect themselves against the environment. That's how they survive into the future. So the variations will always come. What is critical is to ensure that we keep testing for the variants. We keep ensuring that we know what the variants are. We test, we know what the transmissibility is. And where possible, we create the vaccines that are specific to those variants. And the susceptible populations would then be vaccinated against the current variant that is spreading.
Yeah.
That is key information. If we do not test, we will then be using vaccines that are old, that will not protect against new variants. What is also important from the scientist's perspective is for them to test as to whether with this new variant, the current vaccines that we use, do they offer effective protection against infection with a new variant? Do they mediate where even if you get infected, you will not get severe disease, and they reduce the chances of dying from that variant? Those are the critical tests that the scientist needs to do and need to inform the public about the outcomes of those tests.
All right, Dr. Letlape, a great pleasure to have you back here in the new year. Thank you very much, as always, for giving us your time and your thoughts. That is Dr. Kgosi Letlape there, who's a doctor and health activist.